So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is the correct, and after let's discuss this test step by step. So it's 67-year-old man. His major complaints is fever, fatigue and recurrent sinus infections. Recurrent sinus infections frequently is a sign of immune deficiency. He also has cough with sputum. From his anamnesis, we know that he has hypertension, and he smokes for 30 years, which greatly increases the risk of COPD. So maybe his cough with sputum is caused by chronic obstructive pulmonary disease. His temperature is 38, pulse is elevated, and respiratory rate is increased, which are common features during infection. Fatigue is a non-specific symptom. From physical examination, we know that he has enlarged non-painful cervical and axillary lymph nodes. In addition to this, he has hepatomegaly and splenomegaly. He has low hematocrit, which means that he has also low hemoglobin level. And low hemoglobin level we call anemia. Also, he has thrombocytopenia, and his white blood cell count is 38, which is very high. White blood cells is a collective term, and we know that there are two major fractions of white blood cells. It's lymphocytes and neutrophils. Other cells, as monocytes or basophils, are too small fractions to cause significant changes. So our approach is first of all to exclude all cells which are not supposed to be in normal blood analysis, and it's blood cells. In this case, blood cells are absent. After this, we look at lymphocytes. Lymphocytes are 88, which is extremely high. And based on high lymphocytes count, we can straight away say that neutrophils are low. Increase in lymphocytes with increase in white blood cells we call absolute lymphocytosis. And the first pathology that comes to mind with absolute lymphocytosis is chronic lymphocytic leukemia. Chronic lymphocytic leukemia could explain his immune deficiency. Also, as we know, in chronic lymphocytic leukemia, lymphocytes cannot die, so they accumulate in the lymphoid organs, which leads to enlargement of lymph nodes. Also, it causes hepatomegaly and splenomegaly. In addition to this, we know that in chronic lymphocytic leukemia, cells become too old. And the older become cells, the higher the probability that they would not recognize our normal cells, as red blood cells and platelets. And if B lymphocytes are confused, they begin to produce autoantibodies. If autoantibodies are produced against platelets, this leads to immune thrombocytopenic purpura. And if autoantibodies are produced against red blood cells, this leads to autoimmune hemolytic anemia. So everything tells us about chronic lymphocytic leukemia. The question asks us what is the next step, and the next step is to verify that it's chronic lymphocytic leukemia, which will give us opportunity to begin chemotherapy. And the best diagnostic method for chronic lymphocytic leukemia is flow cytometry. In flow cytometry, we determine the presence of a specific CD receptors on lymphocyte surface. So the right answer here is flow cytometry. Lymph node biopsy will be correct for lymphoma, but lymphoma do not cause increase in white blood cell count unless leukemization of the lymphoma occurs. Serum protein electrophoresis is the right answer for multiple myeloma. Karyotyping can be used for chronic myeloid leukemia, and bone marrow biopsy is the method of choice for acute leukemia.